welcome back to my YouTube channel, Midcode Education, guys. So, good evening, all of you. Now we are going to do a December month question paper sessions. Okay, am I audible, guys? Am I audible? Hello. Okay, fine. So, yeah. So let's get start our today's video. Okay. So many of you asked me about to do a live related to anatomy and each and every sessions like anatomy, medical terminology, complaints and regulatory. Hmm? So everyone messaging me. So that is why I'm doing this live. Okay. So let's get discuss our today's questions, guys. Okay. So in December month, anatomy questions are a lot of anatomy questions are asking day by day. Everyone's have different question paper. So you have to understand all uh, important questions. Okay. Because everyone knows about that and everyone have different question paper. CPC examination is it's not at all a single question paper, different paper, right? So you have to study all the important areas, huh? So first of all, the first question is related to nephrology. Nephrology means, study of kidney. Nephrology means study of kidney. And the second one, dermatitis. Dermatitis is most repeated question. Inflammation of skin. Inflammation of skin is the um, dermatitis. And orchiectomy. Okay, ectomy means, removal. So orchiectomy means removal of one or both testicles. That is orchiectomy. Fourth one is phalanges are seen in which part? Phalanges. Phalanges are bones. Okay, it's a kind of bone seen in the foot and hands. Okay. And the fifth one is thyroid gland. Thyroid gland means it is present in which system? Endocrine system. Thyroid gland is present in endocrine system. Sixth is cornea. Cornea means it protect the eye, act as a layer. Okay. And colposcopy related. Colposcopy means female reproductive system. It's a kind of female reproductive system. The part is related to female reproductive system. Next is brain. Brain is it is related to thalamus. Thalamus is located at the brain. Okay. So guys, just noted all these points in your notebook or textbook. Okay. Next is sub. Meaning sub means it's a medical terminology. What is sub? Anyone just guess what is sub? Meaning of sub? No, no, no. Actually, no, dear. Sub means below, not above. Okay. Okay. Sub means below or under. Okay. That is sub. Okay. Okay. So next is phalanges. Phalanges already we discussed. Ah, fingers and toes, hands and feet, everything. Itis. What does itis means? Itis means inflammation. Inflammation. It is the itis. Itis. The word is for inflammation. And use and abuse code. Use and abuse code for in your question paper. Yeah, under correct, darling. In your question paper, use and abuse is mentioned. So, uh, which one would you take to report the code? Which one will you take to report the code? Use and abuse. Tell me. Yes, Venu, correct. Abuse. Okay, use and abuse is mentioned. You have to take the abuse code. Okay, and bilateral oophorectomy. It's a most repeated code only for abuse. Very good. Bilateral oophorectomy, removal of both ovaries. It's a most repeated question asked in the December month, guys. So everyone do check it out. This question, bilateral oophorectomy. It's a most repeated question. Okay, every question paper I see in this question. You are also, I think. Everyone also, yeah, the correct answer. Abuse. Abuse and abuse code is mentioned. You have to take the code for abuse. Okay, super. And next term, um, it is from complaints and regulatory. A repeated question. PHI. PHI means what does PHI? PHI is a what is PHI? PHI is a word. It is commonly in used word. What is the meaning? The word PHI means just comment below the answers, guys. Protected health information. Already I mentioned here, right? Protected health information. And OIG. OIG means Office of Inspector General. And HIPAA law. HIPAA law was made into 1996 is the year. HIPAA law 1996 is the year. Okay. So everyone, please check it out. Okay. It is very important questions. Uh, Let us check the ICD. ICD is most important area. Most important area. You have to understand the ICD concept because it's a repeated area. Okay. So try to study this area. First question is related to T series, guys. T series burn code. Okay, burn code is it's a repeated code. Burn codes and also B20 HIV code. Recently, they are asking at the B20 area. Okay. B20 area is very important. It's a repeated question, repeated area. B20 for HIV, right? For a positive, a patient is came to hospital for HIV and test result was positive. So you can take B20 code. Okay. Mm, next, series of code. S series of codes is very important. S series areas important areas. Okay. And COVID-19 related question is also important. The code for a COVID-19. Oh, sorry. The code for a COVID-19 U07.1. That is the code for COVID-19. Okay. Mm, next, R06 for a shortness of breath code. Shortness of breath code. Okay. That is also repeated. I10 code. I10, I think it's I10 code is for hypertension related code, right? So that code is also important, guys. And in your question paper, recently I noticed a question paper. Question is COVID-19. COVID-19 is also a pregnant lady, 37-week of pregnant lady. She affected, she has affected some COVID-19 also. So how will you code for that? First of all, you have to code for COVID-19 or pregnancy. Which one will what is the sequencing of the code? COVID-19 is the primary code or pregnancy is the primary code? Anyone just tell me? Hi, Kumarala Vamshi. After a long time. 'O' series first code, very good. Vaishnavi, hi dear. Pregnancy code, very good. Okay, primary, ma'am, yeah, correct. Pregnancy code is the primary code. You have to take the pregnancy code as a primary. O series first. Very good, guys. Very good, very good. Nice, nice. Okay, so yeah. So that is the area. But COVID-19 is now, recently asked December month. Mostly they are asking at COVID-19 areas. Okay, so you have to understand the concept there. Let me check another one. Okay, coding guidelines question. Let us check the coding guidelines. Coding guidelines exclude two note is very important, guys. Exclude two note. Okay, exclude two note is very important because exclude two and exclude one also. You have to study both exclude one and exclude two. Okay, that is a important area. Hi, Deepan. Okay, Gumala Vamshi. I hope all the success in your examination. Okay, how's your exam, Gumala Vamshi? Second attempt. Okay, how's your exam? Is it easy or difficult? Hi, Deepan. Hi, Bhagya. Oh, Deepan, congratulations and all the very best for your future, dear. What about your marks? 90 percentage. Wow, super, super, super. Okay, 85 plus. Gomalavamshi, very good, very good. Okay, you will. Okay. Super. Nice, nice, nice. So nice. Actually, one of my student passed her examination today. She got 93 percentage. Nice mark. Actually, 90 plus, actually 80 plus marks is very super. Legends. Because 80 plus is super. Nice mark. Okay. Everyone, not only at 80, also 70 plus. Pass mark is very important for all. Because ma'am exam date January. Okay, January Vaishnavi. Okay. And all the best, dear. Okay. Uh, Actually, I don't know Hindi. So, if you don't mind, can you please translate this in English? Uh, okay, guys, modifiers 59, 78. Both of them are very important. So, guys, you have to study modifiers 50, 59, 78, everything. Every modifiers is very important. Some students are asking me about they left some marks because of the no, they failed some questions or left some mark because of modifiers. Modifier is very important. Third one, okay, Vaishnavi. Third one, if you have any personal things, so if you have any personal things, just message me, dear. 9037030006. My number is there. Okay, I just pinned my number. So just message me, dear. Okay. Use abuse dependence cause is very important. So use abuse dependence. Dependence is most prior, and next is abuse, and last use. Not true about external course code. Yeah, actually, this question is discussing now. Okay, actually, this came coming. Okay, this question is already in my this session, so we will discuss. And quick look examination code. Actually, it's very easy code. 76815. Quick look examination. It's also a repeated question. I remember actually this question is in my examination also. Okay. So everyone just note it down. This important quotes in your textbook. Okay. Let us check the integumentary system, guys. So integumentary debridement related question is there. Debridement and 10060 for incision and drainage of abscess related question. Okay, incision and drainage of abscess related question is there. Benign or malignant lesion code excision. 3 and 5 comes for me. Okay, 3 and 5 means quick look examination, user abuse dependence. Okay, nice, Diban. Actually, in December month, these questions are repeatedly asking everyone's paper. That is why I'm sharing this with you. Okay. Each and every question is very important, guys. Uh, so everyone just note it down, all these things. Guidelines. Okay, okay. Okay, so benign malignant lesion codes, excision, like benign and malignant. So in your question paper, sometimes they are not given any benign or malignant directly. Okay, some question paper they are not given any benign or malignant directly. So you have to take the check the appropriate diagnosis first. Okay, so sometimes they given squamous cell carcinoma or etc. So it become malignant. Okay, so cystic lesion is mentioned, it become benign. So have to understand each and everything, guys. Okay, they're not given any direct questions like benign malignant lesion code excision. Sometimes they're given indirectly, so can just check each and everything. And what about fourth one is very important. Simple to repair, intermediate, complex repair codes. Okay, so I'm asking a question, guys. In your question, simple, intermediate, complex is mentioned. So which one will you choose as a primary code? Simple, intermediate, complex. Just comment below. Complex first. Very good, guys. Anji Gowda, correct answer. Venu, correct answer. Abhidap, correct answer. Complex. Okay. So, uh, Abida, right? Okay. So, yeah. So, complex is chosen as a primary code. Okay. Yeah, complex, next intermediate and simple. Very good, guys. Very good. Okay. So, sequencing is very important. Just note it down. Yeah. Ready, correct answer. And fifth one is Morse surgery code. So Morse surgery code, first of all, you have to understand the anatomical site first. Okay, anatomical site. 17313 is there, 311 is there. Nowadays they are asking 313 questions. Okay, 311 is also there. Darling Vaishnavi, correct answer, guys. Okay, Morse surgery code is very important. And that Morse surgery code, you have to check these tissue block stages, tissue block. 61 excision of sacral pressure ulcer, 15938 code. Excision of sacral pressure ulcer code. That is the sixth one, sixth question. Okay. Yeah. Next, musculoskeletal, some questions, important questions. So, 20552 triggered point code. Okay. Triggered point code is very important. Most repeated. Okay. Second one, 29882. That is for meniscus repair code. Meniscus repair code is there. 29882. 22511. That is vertebroplasty. Vertebroplasty code. Uh, Next is 26705 for dislocation of metacarpophalangeal code. Next, cardiovascular 30K series la 33214. Actually, this area is little bit difficult than other areas. Huh? For me, okay. Uh, so this area, tissue ablation for arrhythmia. 33214 tissue ablation for arrhythmia is repeated one. Second one, 39503 for repair of neonatal diaphragmatic hernia. Third one, 32310 thoracotomy code. ECMO. ECMO is also important. 33956. Okay. Hmm. And check the digestive system series, guys. In digestive system, 47562 for laparoscopic cholecystectomy. Laparoscopic cholecystectomy code is important. 45380 colonoscopy with biopsy is important. 44950 appendectomy related code is important. 45333 sigmoidoscopy related code. 42821 tonsillectomy and adenoidectomy. Questions, Monica? Yeah, actually, I have questions here. Yes, questions. Yeah. Let me check. Actually, I have some questions. Yes, I will upload it soon. Okay, I will share. So now just highlight all the important codes, dear. Okay. Actually, it is four important areas. Okay, I already mentioned in my caption. It's four important area. Okay, so if you want to highlight this code, you can just highlight, or you don't know, just leave it, no issues. Okay, urinary system 59610 delivery code. Okay, 59610 delivery code is important, and prostate biopsy code is also repeated one, 55700. The code is a repeated one. 566204 a partial valvectomy code. Partial valvectomy code is very important. Fourth one, 569804 for male to female surgery code. Actually, guys, this note, just note it down, this fourth one. Male to female surgery course is very important, guys. Nowadays, these kind of question is continuously asking. Fifth one, ma'am, can you tell me about Christmas holiday? I want registration my exam in January. Christmas holiday. Actually, dear, for AAPC 24th and 25 is a holiday. 24 and 25 is a holiday, so there will be no booking slots are available at 24 and 25 dear. Okay, so other days are regular days, regularly working days. 24 and 25 is a holiday. Okay, for AAPC. Hmm? Uh, 52352. If you have any doubts, guys, just comment below. Okay, no issues. Any doubts, you can just tell me. Okay, 523524 cystourethroskopic code. Next, craniectomy or craniotomy for evacuation of hematoma code 61312. A repeated one 69331 tympanoplasty without mastectomy. What is tympano? Tympanic membrane. It is related to which part, guys? Anyone just guess or just comment below? Tympano. Ear, correct answer. Very good, Veenu. Abida, correct, darling, correct answer. Ear. It is related to ear because it's also an anatomy question. Okay, that is why I'm asking. 69666 for oval window repair code is also there. Okay, oval window repair. Next, radiology. 78458 for a venous thrombosis imaging code. 77002 for fluoroscopic guidance code is also there. Fluoroscopic guidance code. Third, 76942 for ultrasonic guidance for needle placement. Fourth one, 72114 for lumbosacral bending views. Lumbosacral bending views code is also there. Okay, guys, just note it down. I hope everyone's examination is just near. Right? Someone, attending the exam at December month, someone at January. Okay, anyway, all the very best for all you guys. You have any confusions related to before the examination, like any examination hall related, exams related, any questions, any confusions? Just tell me, guys. I will guide you. Okay, just comment below your doubts. Hmm. So let us solve some questions. Actually, Monica said that how to practice with these codes. Some questions are also there, dear. Okay. So guys, just solve this question. Hmm. Patient was in the ER complaining of constipation with nausea and vomiting when taking Somirax for her Herbs Foster and Percocet for chronic pain. His primary care physician came to the ER and admitted him to the hospital for intravenous therapy and management of this problem. So, what level of number of complexity of the problem addresses at the encounter? Everyone, please solve this question. Everyone just comment below. After that, I will share the answer. Okay. Everyone just comment below your opinions, your answers. Just comment below the answers, guys. Actually, the answer is moderate. Yeah, correct. Venu Reddy, correct answer. Abida, darling, correct answer. So it become moderate here because already patient has some problems like nausea, vomiting is there. Nausea and vomiting, constipation. Okay, so moderate is the answer. Okay, next is which statement is true for reporting external cause codes of morbidity V002 Y99. Um, yes, Benu, correct answer. Abida, correct answer, guys. Option D. External course code should never be sequenced as a free, a first listed or primary code. Okay, so we can take this code as a last code or a middle, not as a primary. Correct answer. What about others? Just drop your message, drop your comments in the comment box. take your textbook and find this full description of 61535 code. Yes, correct answer, guys. B is the answer. Craniotomy with elevation of bone flap for removal of epidural or subdural electrode array without excision of cerebral tissue. Separate procedure. Correct. Next, let us check the 90K cities important questions. 904604 immunization administration code is important, and 908324 psychotherapy code, 909514 for ESRD service code, fourth one 929334 for percutaneous transaluminal atherectomy, fifth one 930404 for rhythm ECG related code, 619660 intravenous hydration infusion code. And ATK series, all panels are very important. Metabolic panel, hepatic panel, comprehensive panel, everything. All panels are very important. And next, 88000 necropsy related code is important. 88329 pathology consultation code is very important. 89280 assistant oocyte fertilization codes is important. 88300 for surgical pathology code is also. 80305 drug test code is also important. So these are the important areas, guys. So just highlight all these questions or these codes in your textbook and try to solve these areas questions repeatedly. Okay. I have some questions, guys. So I will upload it soon. Okay. Tomorrow or any other days, I will definitely publish all the important questions, CPC questions in my channel. So do check it out. E&M, no, already 214 code is moderate complexity established code is repeated. 99291 critical care code. 348 home or residence services. 391 preventive medicine code. 99284, not a triple nine actually, 99284 emergency department also. Okay, yeah, so almost we completed this session and now move on to some anatomy and medical terminology session, guys. Already we just completed the December month important areas, every chapter wise important areas we discussed. Then move on to the anatomy areas, anatomy questions. Okay, everyone, just solve this question. Anatomy terminology la phalanx is a dash. What is phalanx? Venu, correct, correct, correct. Phalanx is a bond. Very good. It's a bond. Yeah, with the correct answer, dear. Bond. Reddy, correct answer. Okay, Reddy also message. Second one, guys. What is second one? Removal of ovaries called. Option A, ovarectomy. Option B, hysterectomy. Option C, oophorectomy. Option D, salpingectomy. Which ectomy is removal? Abida, correct answer. Venu, correct answer. Well done, my dear students. Okay, oophorectomy. Okay, removal of ovaries means oophorectomy. Already we discussed 1,000 times. Yeah, third one. Which pancreatic cell secreting insulin and glucagon? Uncinate process. Acinar, pancreatic duct, isolates of Langerhans. Venu Abida, correct answer, guys. D. Isolates of Langerhans is the cells, pancreatic cells. They secreting insulin and glucagon. Okay, very good. Next. Bone to bone connection is called what? Option A, ligament. Option B, cartilage. Option C, tendon. Option D, bone. Bone to bone connection. Agishri, okay. Previous question. A bone to bone connection is called. Fourth one. Abida, a ligament. Correct. Venu. Option A. Okay, ligament. What is called inflammation of wall of vein with thrombosis? is the answer? Venu thrombophlebitis. Yeah, okay. Sixth one. What do you mean by Warthin's tumor? What is Warthin's tumor? Bhagya, correct answer. Abhidha, correct answer. Warthin's tumor. What is Warthin's tumor, guys? Benign neoplasm of the salivary gland is Warthin's tumor. Superb. Correct. Which term means the tissue death of an artery or arteries? Tissue death. Atherosclerosis, arteriosclerosis, arterionecrosis. With the correct D is the answer. Venu actually no, D is the answer here. Actually, tissue death means necrosis. Necrosis is the word for tissue death. Okay. So tissue death of an artery, arterionecrosis. Clear. Okay. I'm sorry. Only three options is there, guys. Which term describe a surgical puncture of the eardrum? Actually, the answer is option C. Tympanosynthesis. Okay. Yeah, Venu correct answer. Anji Kauda correct answer. Abida correct answer. Because tympano is completely related to our ear. Okay, so it is that. Okay. So yeah. Guys, this is enough for today. If you have any CPC related questions or any inquiries, just tell me. Okay. Now, any doubts? Just tell me, guys. will let you know your detail the doubts. You have any doubts, any inquiries, or any confusions, or anything? Just tell me. Okay, Venu. Nice. So, can I wind up this today's session, guys? Hmm? Tomorrow I will upload more videos like more questions or any other important things related to CPC exam. So, we thanks for watching and thank you for joining today's live. Okay, so anyone, okay, okay, thank you so much, Abida. Uh, Okay, bye bye. Welcome, 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 guys. Everyone, welcome. And yeah, so I'm now, as of now, I'm wind up in today's session, guys. Good night and sweet dreams. And mm, okay. One more thing, guys. I uploaded my giveaway video in my YouTube channel. So, guys, please check it out and participate the giveaway. Okay. Actually, I'm announcing that. Okay, thank you so much, Venu. Most welcome. Actually, I'm announcing the giveaway at 2025. So it's a Christmas special giveaway. So everyone just participate in that video, like in that giveaway, and send me your answers through my email ID or my WhatsApp number. Okay. So yeah, only for three students. So try to solve all the 10 questions correctly. And yeah, after that, I will select the three students. Then I will give a free CPZ class code. Okay. So that is the giveaway. Already uploaded complete details in my channel, guys. If you are not watched the video yet, just check my YouTube channel. Okay. I uploaded recently. So then participate the video. Okay, guys. Hi, Govardhan. Monday. Okay, first attempt coming Monday. Okay, anyway, all the very best. Okay, all the best for your exam. God bless. God bless you. First attempt. Okay, coming Monday. Okay. Any doubts, dear? Have any doubts? Just tell me. I will help you. No issues. Actually, January month, no, dear. Exam actually not at all. Okay, there will be no exam pattern will not at all changing. Okay, syllabus is almost the same syllabus. Some new areas were updated. That is the only one thing. Okay, otherwise everything is same. Okay, so can I wind up this today's session, guys? Okay, so see you tomorrow. Bye bye.